You will need to have a blood test each time you go for chemotherapy, so a sample of blood will usually be taken from a vein in your arm by your medical team, which then goes off for analysis while you're in the daycare unit. At this point, you may also have some other general health tests, for example, having your blood pressure measured. Other tests you may expect could include regular scans of your tumours, if it is measurable, so as to monitor how well your treatment is working. Primary medical therapy can also be used to determine the effectiveness of treatment. The blood test allows us to check the effects of the chemotherapy on your blood and bone marrow. We check the numbers of red blood cells, white blood cells and platelets in your blood before you receive your next treatment. As well as looking at your cell numbers, your blood sample can also be tested to check that your kidneys and liver are working well. After your blood test, you will have to wait for a short time in the unit for the results to check if it is okay to go ahead with your treatment. Hopefully all will be well, but if your red blood cell count is too low, in other words you're anemic, you may need to have a blood transfusion to adjust this, although treatment is not typically delayed because of anemia. Your treatment may be delayed if your white cell count or platelet counts are too low, in which case you will usually be asked to come back approximately 1 week later, depending on your clinic, to have another blood test. In some cases, these tests may be done a day or two before your treatment by your doctor, practice nurse, or at a hospital closer to home. This will help reduce the amount of time you have to wait in the unit. Hospitals will have a range of different strategies in place to improve efficiency and patient experience, and these will vary between clinics. When all the appropriate tests have been completed successfully, your chemotherapy drugs will be prepared specifically for you, so you may have to wait whilst these are made by the hospital pharmacy and are delivered to the unit for the nurse to administer to you.